Many people don't realize that just like humans, dogs and cats require special care when it comes to pregnancy. Dr. Joel Conn from Pismo Beach Veterinary Clinic joins us this morning with everything you need to know about breeding your pet. And so yeah, this is something that we don't think about.
We don't talk about a lot, and I think what we wanted to kind of emphasize this morning is that breeding a pet shouldn't be taken lightly.
Okay.
Pregnancy is a big deal. And you know, there's millions, literally millions of homeless pets in this country.
Right.
And so if you're going to breed, you want to make sure that you do your homework.
Okay.
So it all starts with planning. Planning, and begin by getting a book, going to websites, reading and reading and reading and reading.
Okay.
You want to get your information first because you know, breeding an animal is not a minor undertaking.
Right.
It takes a lot of work. It takes a lot of effort. Potentially takes a lot of expense. And I think a lot of people go into it thinking this will be a great experience, you know, just to share with my child or something like that. And you have to kind of decide, is that a good enough reason by itself to breed an animal? Because, you know, in general, what we're looking for, if you're going to breed, and responsible breeding is, of course, important, you want to breed to improve a breed line.
Okay.
Okay,
Right.
so not just
that's
the
something
experience.
that's good to point out, the intention of, you know, doing it.
Right.
Some people may think that you're going to actually make money off of these pets as well. And as you said, it can be very expensive. It can be quite the opposite.
It is, and especially the first time or two that you breed, if you do it right, you're likely to lose money.
Okay.
So you know, it's something that I think people do go into it thinking, oh, I can make a few bucks here.
Not a good intention, by the way. We do
not a good way to do it. And if you do it right, it actually can be quite expensive. And there are a lot of very responsible breeders out there. So first of all, you know, there's a big time involvement, both before, during the pregnancy, after the puppies are born, and then the expense. So what it kind of starts with is you have to decide, is it right for you?
Okay.
Is it right for your family? And is it right for your pet? You know, some animals have a tough time with pregnancy, just like humans do. So, you know, those are all factors to kind of consider.
Okay. And then when you do talk about improving the breed line, what are, you know, who should consider doing breeding their pet? What do you mean by that?
Well, in general, when you're breeding, you're breeding within a breed line. So 2 boxers, for example.
Okay.
And you know, so if you have one of either the male or the female, you look for an appropriate mate that's going to improve the qualities of the breed. And each breed has certain breed standards and certain attributes that we're looking to improve, or in some cases eradicate from the breed.
Okay.
You know, certain breeds have genetic diseases, for example, that you don't want to continue to breed into it. One of the most obvious examples of that is hip dysplasia. So very, very common in large breeds, things like labs, goldens. So one of the things we do as our pre-pregnancy evaluation is take x-rays of their hips, in some cases take x-rays of knees or elbows as well, depending on the breed. Okay. And those actually get submitted to a panel of radiologists that review the x-rays and decide, is this animal appropriate for breeding? Okay. So that's one of the initial pre-pregnancy steps that should be taken with any animal. Okay. You know, along with that, checking blood work, doing routine parasite screening, and treating for parasites also really important, so you're not, you know, breeding in any, you know, negative attributes in that way.
And then once your pet is pregnant, if you've gone through all of the appropriate steps, you've done your research, and you've gone ahead and breeded your pet, what's the next step? What needs to happen during the pregnancy?
So the next step, I mean, first of all, we try to do exams all along the way, just like you would in a human. So first, establish a relationship with your veterinarian. Make sure you have someone that you can talk to and that you trust and can work with, and then set up a plan. Okay. It all starts with a physical exam. So immediately post-breeding, you want to get in there, do a physical exam, make sure everything's, you know, looking right, the animal's not having any issues. Okay. You know, things like infection, that kind of stuff. And then from there, we actually do a couple of diagnostic steps along the way to figure out, are we going to have problems with the pregnancy? How many puppies are there? Okay. And are they viable? Okay. So at 25 days, typically, that's when we do the first real pregnancy check. That's when they come in for their ultrasound. Okay. So just like in humans, we actually get them in for the sonogram. We look at the puppies, and we're checking more, not so much for number of puppies, but for viability. We're looking at heartbeats. make sure there's no complications there, that the development is normal. 25 days is about as early as we can pick that up.
Okay. And now moving on, we just have a few more seconds, so quickly we'll go through the whelping, the puppy care. I know this is probably one of those things you could talk about for days.
It is. It's a long subject and something you should probably talk to your veterinarian about. But I think one of the key things is that going into whelping, make sure you know how many puppies there are. And also, prior to the animal having those puppies, make sure you've started to find homes for them, too. Because that can be a challenge once you have puppies to locate homes for them. So a lot goes into it,
That's
a lot goes into it.
Absolutely. And I think that's one of the main things. You know, we have the Pound Puppy each Friday. We have so many dogs that we see at the shelter. And typically, those seem like those are unplanned pregnancies in that case. But definitely something very interesting to think about is this side of it. All right. Well, thank you, as always, Dr. Conn, for joining us.